Welcome to Mental Health Dumpster Fire, a podcast where therapists give their real opinions on mental health, relationships, parenting, and pop culture. Hosted by Courtney Laver, licensed clinical social worker, and Jess Miller, art therapist. This podcast is for educational and entertainment purposes only and cannot be used as a substitute for therapy. We cannot provide mental health services via this podcast or social media. We occasionally use explicit language in our podcast and discuss serious mental health and relationship issues. Please use discretion if you are listening with children. We hope you enjoy the show. Don't forget to subscribe. Welcome to the show. Thanks for joining us, folks. All right. This is going to make me paranoid the whole time since I'm the one presenting things and my microphone wasn't recording. So we're going to keep going back and forth.
Yeah, we'll just have to check in.
So I can try to look at the same time. How's it going?
Not bad. Things are going.
Yeah.
I'm about to go on vacation. So
Yay.
I'm very much looking forward to that.
You need a vacation.
I do need a vacation.
There's like on and off thunderstorms out here today. So I'm hoping that doesn't mess up this recording. But
oh, I didn't think about that.
I don't know. Loud thunder. It's a Monday.
Yeah.
I'm feeling the Monday today.
Yeah. Some Mondays are harder than others for podcasting, that's for sure. Today is like a curl up in bed and read a book day.
Yeah, because it's rainy.
It's rainy.
And it's going to be rainy all week. And
it's almost October.
Yeah.
That's why I've got my Halloween stuff on.
Yep.
Yeah, it's the little things. Got to find the glimmers within all the chaos right now.
Yep. I've been looking for my Halloween Alani. Haven't found it yet.
Oh, yeah. I like the little jack-o'-lantern, whatever that flavor was.
The jack-o'-lantern.
Or it had a pumpkin on it.
Okay.
And the witch one, of course.
Right.
That one's the
haven't
best.
had the pumpkin-y one, but
It's not pumpkin flavored. It just had like a little jack-o'-lantern guy on it.
yeah.
Maybe I'm thinking of a different brand.
Maybe. Yeah, I don't know. Because I have only seen the Witch's Brew, and that's what I'm looking for.
I love that one. I like that one and the outer space
Yes.
one.
Yeah.
And then I also love Witch's Brew, the red wine. It's like a spiced red wine.
Uh-huh.
Very good.
Love it.
I might need some of that soon.
Well, today I thought we would help some people who are looking for therapists.
Yeah.
Because I have tried helping some friends find therapists in the past. I've looked for therapists myself in the past.
Mm-hmm.
And the number one place that they send people for searching for therapists is Psychology Today.
Yep.
And I think that's a great resource if you don't know somebody who's already in therapy who could maybe ask their therapist for some references or something. You can look at their little bio. You can look at if they're accepting new clients and all that stuff. If they take your insurance, it's all there. But sometimes I'll be looking at a profile of somebody and I feel like the language that they're using is very clinical.
Mm-hmm.
And I wonder what it's like for somebody who hasn't been to therapy or doesn't know about different types of therapy.
Right.
Like, I don't need to be pulling up multiple tabs to see if you're going to be a good fit for me or not.
Right. Yeah.
Obviously, talk to them if they seem okay, but you're still not sure. Like, you can call and say, hey, can you explain to me what this is? But I thought maybe we could save some people some steps.
Yeah.
And look at some random profiles and see if we can decode them.
Okay, yeah. I love that idea.
And then we also get to judge strangers on the internet.
Yeah. Hey, you put your stuff out there for public, we're going to judge it.
Yeah.
If you put it on Reddit, we're going to judge it. If you put it on your Psych Today, we're going to judge it.
Yeah. So I have Psychology Today pulled up, and I have a random zip code generator.
Ooh, love that. Okay, so we're doing nationwide. That's
Yep.
probably safe.
So I'm just going to copy and paste this zip code for, we'll start with Elkhart, Indiana. Don't know where that is.
No idea. Never heard of it.
I'm going to put this in here, and then should I filter it for,
I mean,
like, specialties or?
Let's do this first one like we're going to therapy for the first time and we have no idea what we're doing.
Okay. Our first victim, just
Who
the
comes
first
up
one up
first?
here.
Yeah.
She's a telehealth therapist, and her name is Christine. So let's look at her. She's got a phone number and a box where you can email her. It doesn't say she's not accepting new clients, but she says online only.
Okay.
She is a LMHC, licensed mental health counselor,
Yes.
and she's an RN. Interesting.
Oh, that's a cool combo. I like that.
Yeah. Her bio says a new year can be a new opportunity to explore those beliefs, feelings, or behaviors that no longer serve you. We can dive in to identify what needs to be honored and what needs to be let go. I can help you with a relationship that is based in respect for you and your lived experiences.
Okay.
Simple language so far.
Yeah.
I will provide that safe space to talk about the things in life that do not seem to make sense. During our time together, we can explore alternative ways of thinking, tools for managing emotions, and skills to navigate relationships. Making the decision to work with a therapist is a powerful move to finding solutions that support you in your day-to-day life. I look forward to helping you. My email and phone number are listed. Feel free to reach out, and I will get back to you. Oh, a perfect bio.
That was really good. And they use language that like is understandable no matter what your background is pretty much, but also like kind of specific language.
Right.
To where
Challenging thoughts.
Yeah, like she's talking to a specific audience, which is what they tell us when we write our bios, is like speak to the like specific clients that you are looking for.
Yep.
So that's an excellent bio, I would say.
She takes insurance, folks.
Ooh, okay. If you live there in Indiana, Elkhart.
Elkhart,
Indiana.
Yeah.
I can't believe I got that right.
She got her master's in counseling in 2019. Me too.
Nice.
And her specialties are anxiety, grief, and trauma.
Okay.
She works with adults, and she does EMDR, integrative, and person-centered. I initially focus on establishing a person-centered relationship that creates a space that feels safe to explore the concerns you have. I incorporate regulating skills such as breathing, movement, visualization, and journaling to help you develop skills you can use outside of sessions. EMDR is another technique that I will support my clients with to address trauma and negative beliefs.
Okay.
I feel like most people who are going to get EMDR are looking specifically for an EMDR therapist.
Yeah, because usually someone says, like, you would benefit from EMDR, this is what it is, and then they know what to look for.
Yeah. But I think she did a great job explaining what she does in a very easy to understand way. She talks a lot about, like, wanting to make sure that her clients are comfortable with her before diving into anything too heavy. And she has a picture of a dog on her profile.
Oh, it went out. I don't know what to do. It's weird.
Okay. We're just going to pretend like that didn't happen. And we're going to read her profile. Okay, let's read Courtney's profile.
Nothing happened.
She's available both in person and online. Okay. Hello. I am a licensed clinical social worker who enjoys working with a variety of ages and challenges. Whether you are working to heal from trauma, experiencing mental health struggles, or sorting out relationship issues, exploring yourself, or wanting to make a positive change, I am here to provide support in a safe and non-judgmental environment. Therapy can be helpful in many ways and is highly individualized. There is no one-size-fits-all approach. I try to walk alongside you to help you reach your goals and to work on what's important to you. I have experience doing therapy with children, teens, and adults. Okay. You sound very friendly. You sound like you don't know what you like to focus on. Or you like to focus on a lot of different things. Like, that's friendly but very vague.
Yeah. Like, I'm open to all, almost kind of a thing.
I work with a variety of ages. Here's a very long list of things that maybe you want to do. You're exploring yourself. You're making a positive change. You're experiencing mental health struggles.
Yeah. Like, if I read her bio and tried to figure out, like, maybe what kind of modalities she follows, I wouldn't be able to pick any.
Yeah. Okay.
It's almost too vague.
So far. So then her next paragraph says, I have specialized training in sexual assault and domestic violence. I have received training in multiple evidence-based practices, including TFCBT, EMDR, ERP, and more. We would work with whichever modality makes the most sense for you. I utilize a strength-based, trauma-informed, and open style. She sounds like she and I, which is funny because her name's Courtney, maybe have similar backgrounds of like coming from nonprofit or something where we were trained in, it was very important that it was evidence-based and we follow it to fidelity and blah, blah, blah. But then it's like, that's important for the agency. It's not necessarily important for the client. Like they don't really care
Yeah.
if it's evidence-based necessarily. Like, you know, maybe it's nice for them to know, but like overall they just want to know what it is and how it's going to help them.
Right. And then they kind of listed all the different things. And like there was one I think I didn't even recognize on there.
ERP.
Yeah, I don't know what that is.
I think that's exposure.
Oh, okay.
For like OCD.
Gotcha.
Yeah.
Okay.
Exposure and response prevention.
Okay. So that like if I was going to offer some kind of edit, instead of stating ERP, since that's kind of like only known to people within OCD community, she could say like she has experience with exposure type therapies for treating OCD or something.
Right. So she says she has specialized training in sexual assault and domestic violence. And then she says she's trained in TFCBT, which is for children.
Mm-hmm.
EMDR, which could be used in any age.
Mm-hmm.
And then ERP, which is usually specifically for OCD.
Yeah.
And then, and more. Like,
yeah.
Okay.
It sounds like she needs to maybe figure out her niche a little more. Like what, like I said earlier, like speaking to her, like the clients that she is looking for, her specific niche of client that she's looking for to work with.
Yeah. And maybe she doesn't know and she doesn't want to limit herself, which I think is fair.
Mm-hmm.
But this is like, if I didn't know what TFCBT was and I'm an adult looking for a therapist and I look up TFCBT and see trauma, I might think, great, she does I'll do TFCBT.
Right.
And then I might get there and she'll be like, oh, no, that's for children.
Mostly for kids. Or
And
pretty
it's
much,
like,
yeah, for kids.
Okay, well.
Why am I here?
Why am I here?
Yeah.
Yeah. And then her last paragraph says, it can be hard to reach out for help, and confronting these things can leave you feeling vulnerable. Maybe something has recently happened in your life where you felt like you've needed this for a while. You are strong for taking this step. I'd love to connect further to see if I'm the right fit for you or your family. I unfortunately do not accept Medicaid. Maybe that's something that people call her a lot.
Yeah,
Or,
I could see that. Especially if she's doing a lot of trauma-centered work.
Yeah. Well, yeah. So, I mean, that's why we're doing this, so that we can explain, like, so she probably has experience with a lot of different clientele, a lot of different ages, just based on where she was able to find a job before. And now she's narrowing down what she likes to work with, which is fair. Like, you know, you get training in therapy when you go to grad school and when you're looking for jobs and you don't have a niche yet.
Yeah, you don't know exactly what you're wanting to do yet.
Right. And everything sounds exciting. Like,
yeah, that's how I felt.
I could work with kids, or I could work with domestic violence, or I could work with OCD. Like,
yeah.
Those all sound like fun.
Right. It's like, I'm interested in all these things. So I'm going to get training in all of them and then figure it out. But then just listing them out later. Yeah.
Yeah. And then if I'm a person with OCD looking for an OCD therapist and all she has in here is ERP one time, I'm probably not going to look at her and be like, okay, so she knows what she's talking about OCD.
Right. She sounds more like trauma-centered to me. Like, that's kind of her focus area, maybe. Big
Yeah.
trauma.
When there's not specific language in there, it makes me feel like they're a newer therapist, which isn't a bad thing.
No.
And it doesn't necessarily mean that they don't know what they're talking about and can help you for your specific issue. It's just more vague.
Yeah. They have a wide range of things that they want to do.
Yeah.
So then they have to be more vague to get it all to fit in their profile.
Yeah. Whereas the last lady, she was open-ended and didn't say a lot of specifics, but you could tell that she was seasoned just in her language.
And she just used a very specific language that appeals to a specific type of client. Yeah. That, like, if they were to read that, they would connect to it. And that's the purpose of writing, of therapists having their, like, psych profiles written that way.
Yeah. So she says her top specialties are trauma and PTSD, sexual abuse and anxiety. And then her treatment approach, she has a lot of things listed.
Yeah.
Well, and some of these are like not even therapies. They're like compassion focused or trauma focused or strength based. It's like those aren't specific therapies.
Yeah.
Those are more like vibes.
Yeah. The vibe of the therapy you're seeking.
Yeah.
Which, if you're seeking therapy for trauma, you would be seeking trauma focused therapy. Yeah, makes sense. But I think listing a bunch of stuff like that as, like, for someone who's new, maybe they're just starting their first private practice or they've joined a group practice or something. They're just kind of like, I don't know what I want to do exactly, but I have all these interests that I want to do more of. So I'm going to put them all there on one.
Yeah. Okay. Let's go to another town. I do wonder about, like, what the algorithm is, like, when you don't filter through.
Yeah, like which ones pop up first.
Yeah, like, how do they decide
I don't know.
who's listed
Maybe we
top?
should play with some filters next.
Okay.
I think what a good filter to put in is a male therapist.
Okay, we can do that.
People always tell me they can't find them.
Yeah. We're going to go to South El Monte, California.
Ooh, California.
And we will filter by male and then pick a number.
8.
1, 2, 3. Ooh, there's 2.
Oh, there's only 2? Middle of nowhere,
There's
California.
2, and then there's people who, and then it says more therapists nearby.
Okay, but only 2 in that specific zip code.
Yeah.
Wow.
Only 2 that have that zip code listed.
Okay, that are male, I guess.
That are
is
male,
the other thing. Yeah. Okay, let's just go with number 2.
Okay. Mark is an LCSW.
Yeah, no art therapist yet.
He has 2 offices. We could search for art therapy in the next.
Oh, that's true. Yeah, you can search by license.
He has 2 offices in Pasadena and Los Angeles.
Okay.
So I guess South El Monte is Pasadena. I don't know. I don't know the geography of.
We don't live in California. We don't know.
Okay, Mark is a LCSW. He says, therapy provides an opportunity to slow down, reflect, and make meaningful change. I work with adults experiencing anxiety, depression, stress, grief, relationship concerns, and major life transitions. My style combines warmth, curiosity, and honest feedback with strategies you can apply right away. I like that. Clients often appreciate feeling both deeply understood and challenged to grow. Together, we explore roots of difficulty, recognize patterns that no longer serve you, and create more flexible ways of responding. I integrate mindfulness, relational therapy, and evidence-based approaches to foster resilience, clarity, and lasting change.
Okay, that reminds me of the first person's.
Yeah, not very specific, but also kind of specific.
Yeah.
He specifies he works with adults.
Yep.
Anxiety, depression, stress, grief. So the more common things that people go to therapy for. He's going to help you feel understood, but also challenge you. I liked that.
Yep. Strategies that you can immediately start using. That's like kind of solution focused.
He has a really cool, like, mid-century modern office.
It looks like a man's office.
Yeah. But I like his leather chair.
Leather. Clean.
Yes. Okay, he says, I view therapy as a collaborative process where curiosity, compassion, and directness come together. My role is to listen carefully, ask questions that deepen understanding, and offer tools that support change in daily life. Clients often value the balance I bring between empathy and candor, which helps create both safety and momentum. Ooh, he's explaining his personality very well.
I like that. He's like, I will call you out on things in session if it is therapeutically beneficial to you. That's what he's saying.
Yep. Finding the right therapist is important. I welcome clients who are curious, motivated, and open to growth. If you are seeking a therapist who blends warmth with clear insight and practical strategies, I may be a strong fit. Reach out to schedule a consultation. I look forward to supporting your journey toward greater awareness, resilience, and well-being.
Yeah, that was a good one.
Yes. Man, to be a therapist in California. He's an out-of-network provider. He doesn't
Okay.
accept insurance.
Gotcha.
Individual session, $225. Huh?
Dang. For an hour?
Yep. And that's just individuals. If you want a couple sessions, $275.
Maybe I should be in California.
Right? I mean, you probably have to charge that to live in Los
That's
Angeles.
so
Like-
true. I don't even know if I want to live near Pasadena.
Yeah.
I don't know if I'd want to live there. I'm more of a Northern California person.
Mm-hmm.
I've never been there, but
Yep.
give me some trees and mountains, please.
Okay. His top specialties are men's issues, internet addiction, and sexual addiction. Which is interesting because he didn't
specify
say
that.
anything about that.
But maybe, again, like your specialties areas might not necessarily be the clients that he's looking for. Like maybe he's looking for other types of clients, I guess.
Yeah, maybe he doesn't want to be too specific,
Mhm.
but then he wants you to know, like, if that's what you're...
If that is something,
struggling with.
yeah, that he does have that specialty. Because I don't like if I had the specialty in training for like sex addiction, I don't know if that's one of the very first things I would put in my bio. I think
Sure.
that's something that I would put
Unless
into my
it's
like
the
list
only
of things.
thing you do.
Right. Which
Yeah.
that would be exhausting if that was the only thing you did.
Yeah. I also like he has this little blurb next to the types of therapy that he lists out, which is a very short list, which I appreciate.
Yeah.
He says, my orientation is grounded in recent neurobiology research, integrating insights from mindfulness-based approaches, dialectical behavioral therapy, attachment theory, trauma-focused interventions, and acceptance and commitment therapy. This approach emphasizes the interconnectedness of mind, body, and relationships and how our experiences shape our brains and influence our interactions with others.
Love that.
Yeah, I like that he was specific in the therapies that he uses, and then he explains kind of what they are.
Yeah. It's like his, like the first part you read on if you're looking for a therapist is their like bio chunk and then maybe like the fees and if they take insurance. And then it's kind of like if you want to explore this therapist more in those sections, he explains more specifically what he does.
Yeah.
That's
And I like
smart.
that Psychology Today gives you that option to add those little blurbs.
Mm-hmm.
So it's not just the 3 paragraphs that they give you. It's very template.
Yeah, it's set up. The way Psychology Today sets it up so that we're giving everyone all the information that they need, and then it's formatted in a way that like you kind of click through and you find the stuff that you need.
Let's look for an art therapist in
I'm
Helena,
interested.
Montana.
In Montana.
Mm-hmm.
Well, they don't have a program there, so I don't think they do. ATCB.
I'm looking
like
under
that.
like therapy types because I feel like that's what a person would do.
Is put it
Art
under there.
therapy.
Yeah.
Here we go. 19 therapists nearby in Helena, Montana. Debbie is a LCPC, NCC, and CCTP. I don't know what those are.
I don't think any of those are the art therapy ones.
So LCPC is licensed clinical professional counselor.
Okay.
NCC, National Certified Counselor.
Okay.
CCTP, Certified Clinical Trauma Professional.
Okay.
Okay. Whatever obstacles and struggles you may be going through in life, I consider it a privilege to help you deal with them. You may have a lot coming at you, trying to make decisions, maintain life balance, and all while dealing with intense emotions. My goal is to help you look at options, identify solutions that work for you, and help you to discover your true potential to create your life as you want it to be. I see each individual and their situation as unique. There is no quick fix or one-size-fits-all solution. I collaborate to help you successfully work through the challenges you are now facing. I use a holistic and integrative client-centered solution-focused approach to help you find solutions and build on your strengths rather than weaknesses while finding positive ways to move forward. No matter what you are struggling with, you can rest assured that you will be in a safe, supportive, and encouraging environment where the focus will be on you. Starting now, you can begin a brand new journey toward a more positive path for yourself, one that is filled with growth, well-being, acceptance, and empowerment. Everyone has a narrative that has brought them to today. Are you ready to change your story?
Okay.
I mean, she explains that she's holistic and client-centered, solution-focused.
Yeah. Felt like she kind of crammed a lot in there, and then when it was all put together and read, it was hard to follow, I guess.
Yeah, I wasn't clear on, like, what she works with. Like,
Yeah.
it was general, but too general. Like, you may have a lot going on. You're trying to make decisions. You're dealing with intense emotions. I don't know.
Yeah. Like, I mean, those are all things that I would expect in most therapy sessions, like most therapists with. So I don't know. Maybe a little too general on that one. Hard to tell, like, what they do.
She got her undergrad in Arizona State, so don't go see her.
Oh. Okay.
I'm just kidding. I went to the University of Arizona, so they're my rival.
Oh, I was like, oh, we got beef with Arizona.
It's a big party school.
Oh, okay. ASU.
Yeah.
Okay. That's funny. It's like U of L in UK, I guess.
Yeah, we always joke, like, if you go to Arizona State, that you're just there to party and you're not actually getting an education, and everybody, like, they accept everybody because you're stupid. Like,
that's funny.
I'm sure she's a very smart lady. Her specialties are trauma, PTSD, anxiety, and family conflict. I mean, general, but I feel like she could have said more about family conflict.
Yeah.
Oh my God, she lists so many types of therapy.
Yeah, I need to go through and edit my profile. I don't think I changed my types.
And
I haven't
she just
done that in a
lists
while.
art therapy as a type of therapy that she does. That's why she came up in this search. She doesn't actually focus on art therapy.
She uses therapeutic art.
Probably.
Yeah.
But she doesn't say anything about that. She's just talking about finding solutions. So
yeah,
if I'm looking for an art therapist, she's not going to fit what I am looking for.
Yeah. You got to specify if you're an art therapist and you want to do art therapy with your clients. That's something like right off the top that needs to be said.
Yeah.
I can't tell you how many people have been assigned to my caseload that had no idea I was even an art therapist. And I'm like, well.
Right. I don't know what to tell you. All right. Well, let's look for an art therapist in Massachusetts.
Yes, they have a program there. Pretty sure it's in Massachusetts. There's one very close to them, if not.
Milford, Massachusetts.
Milford.
Okay. Diane is a registered art therapist.
There we go.
Let's look at Diane. She's an LMHC in Malden, Massachusetts. She's available online only.
Interesting.
Okay, Diane writes her bio in third person. Diane is a nationally board-certified counselor, registered art therapist, and licensed mental health clinician. In 2014, Diane started a nonprofit organization named Healing Stitches, which advocates art making as fuel for healing. Diane loves to explore therapeutic art-making techniques, including projective drawing analysis. In addition to dream analysis, Diane explores psychodynamic theories with clients. Ooh, she's a unconscious lady.
She's a brain person.
Yeah. Diane provides telehealth services for individuals through bettering her clients' well-being is a top priority. Diane, you need to proofread this.
This sounds like a copy and paste from, like, if she was a professor from her, like, school's bio almost.
Yeah, but, like, that sentence went in two different directions. Diane is trained in Reiki and EMDR. Diane prioritizes safety planning, recovery, and self-care with all clients and is dedicated to providing client-centered, and then in parentheses, Adlerian and Rogerian therapy, which is interesting.
Both.
Because I usually hear about those.
It's usually one or the other.
Yeah.
And those are usually with kids.
Yeah, I usually hear about
Especially
Adlerian therapy
Rogers.
and play therapy.
Like Carl, is he Carl Rogers? Yeah, Carl
Yeah.
Rogers. A
But
lot of
then
his work is
also
with
it's-
kids. And so's Adler.
Psychodynamic
Yeah.
and dream and okay.
So she's using like Jungian stuff and Adlerian
And Rogerian.
and Rogerian.
And Freudian. I don't know.
I would hope not
Okay.
Freudian.
Yeah.
I hope we're past that.
Diane, friend, you need to proofread your Psychology Today profile because your last paragraph switches to, I have a passion for helping others.
Oh.
I found this career through my dual interest in psychology and art. My clients inspire me in all ways every day, taking small steps towards goal setting using SMART goals, which include being realistic. That's not a sentence. To be able to discuss and address whatever is on your mind. Also not a full sentence. Okay.
Yeah, okay. So we've got some grammar issues going on and switching from third person to first person, which is tricky. I don't like going, like when I go through a Psychology Today profile and they're talking in third person. I don't like that personally.
It doesn't feel like you wrote it.
It
Feels
because
like
probably
somebody
not.
else wrote it. And
Yeah.
it's like,
It feels like a copy and paste job to me ish.
okay. She does all these types of therapy, and then it also says Christian counseling. What do you do, Diane?
Yeah, she's a little all over the place, and then is also throwing clinical language in on top of it, which is just making it very confusing.
Yeah. Does she only do art therapy through her nonprofit?
Right.
Are we doing Reiki and EMDR at the same time? Okay.
That'd be interesting.
So, I think we should explain Adlerian and Rogerian. I have not seen that in a Psychology Today profile because who knows what that is? What layperson?
No one would know.
Okay.
Unless you maybe like work with kids. Like, I feel like teachers have probably heard of Carl Rogers, I would imagine.
So, Adlerian therapy is goal-oriented, positive psychodynamic therapy that uses the theories of Alfred Adler, who was a colleague of Freud. So, it looks at like the difference of developmental stages, and is very focused on like if you feel inferior, that's where your problems are coming from.
Yeah, yeah. And then in each of the stages of life, there's different specifying inferiorities
Yeah.
that people would feel.
And usually I hear about it as a method of play therapy or art therapy.
Yes. Which she didn't specify. It was Adlerian art therapy.
Right.
But
she just said it was like her
it was
theory,
like it was client centered
lens.
and then within it being connected to client centered, right?
Yeah,
Is that
she
how
said,
it was written in her profile?
Diane prioritizes safety planning, recovery, and self-care with all clients and is dedicated to providing client-centered Adlerian and Rogerian therapy.
Yeah, I don't think she doesn't need to add the Adlerian Rogerian therapy.
Right.
Also, those two are kind of like not opposites, but are different. Not that they're not like one's better than the other or anything like that, but it's just usually people subscribe as a therapist to one or the other more strongly.
Yeah, so Rogerian is very non-directive.
Yeah. That's more like play therapy-esque stuff. Like child-centered play therapy.
Right, which is funny because I'm been learning about like how to become a registered play therapist, and you have to pick.
You have to pick one,
You have to pick a theory, and it's either child-centered, which is like the kid plays and you're just there to support, and the belief is like they will work through it.
Yeah.
And you're there
You're a witness
as a
to the
support.
process. Yeah.
And then Adlerian is much more directive, and it's like, here's what we're gonna do, and it's a lot more like family integrative and like just being like, here's the activity for today. We're gonna work on this feeling of inferiority that you have. So,
and it's like that in art therapy too. Like Adlerian art therapy and Rogerian art therapy are like that
yeah,
too.
yeah,
It's like the child-centered play therapy. It's non-directive art therapy. You give them the materials, you let them make the art. You're there to help them process the art and the process of making art.
right.
And then Adlerian type art therapy is like, which she talked about a projective art assessment. Like that would be an Adlerian thing.
Right. Because it's very like, it's more psychodynamic. It's more like,
Yeah,
looking at your unconscious,
Yeah, like
your subconscious.
draw a picture of your family would be a more Adlerian type.
Yeah.
And then analyzing their drawing of their family.
Right.
Which it's like, again, it's not that one's better than the other. It's just that people tend to subscribe their
'cause
therapy to one or the other.
Appreciate both of them, and like I might have trouble when it comes time for me to pick. Like,
yeah.
I might be like, but some kids would benefit from this, and some kids would benefit from that,
And that's
like,
usually how it goes. Yeah.
Sure, but like you need to be an expert in one.
In one. Mm-hmm.
I don't know. She's kind of all over the place.
Yeah. And the dream analysis stuff too. I don't know. It's so weird.
Dream analysis, but also EMDR, but also Reiki, but also art therapy. There's a lot going on.
We're doing
But also Christian counseling.
Yeah, like we're doing neuroscience-y things and then also the woo-woo stuff that I like to do.
Yeah.
We're kind of all over the place. Which isn't bad. It's just like if you're writing a description of yourself to a potential client, you want to write the description of the client you're looking for, right? So like pick one.
Yeah.
pick something that you like doing more Adlerian, then that's what you write your profile to look like.
Yeah.
So I would be super confused reading that one looking for an art therapist because she didn't really say she does art therapy. She just talked about the nonprofit in third person.
Yeah.
Which probably came from the website about the nonprofit. If it's in third person. I don't know.
Maybe. I don't know.
Interesting. Sounds like a cool nonprofit though.
Right. It does. But if I'm looking for a therapist, I don't need to know about your nonprofit.
That's true. That's not really information that needs to be there.
Especially in the first paragraph.
Yeah. And then listing the acronyms that come after her name all out.
Yeah.
People can Google that if they need to figure it out.
Yeah.
Like maybe having the big one listed, but otherwise people will Google the other ones that you have to figure them out.
Yeah. All right. Well, let's look at Mandy. She's also in Massachusetts. And in the list of searches, it says licensed mental health counselor with a specialization in art therapy.
Okay, cool.
So she's also telehealth only.
Interesting.
And she says, "Hello, I'm so glad you have found your way here. I am Mandy Glaser, a licensed mental health counselor with a specialization in art therapy. My goal is to support you in creating the life you want for yourself. I work with each client to clarify their goals and future vision for themselves. This may include addressing areas of employment, communication skills, relationships, managing emotions, stress, or self-identity. Sessions are relaxed, friendly, and conversational. Sometimes we sit with heavy emotions and sometimes we laugh. If you are open to it, we can use creative expression to help further our therapeutic exploration. We began by envisioning the life you would like to experience. We then work from there to identify what is needed to create that vision. We will next define the steps needed to progress toward that goal and how we will approach each one." Kind of lost me at that last paragraph, but
This is like kind of explaining solution focused therapy a little bit.
yeah. What do you think about her? What do you think as an art therapist?
As an art therapist, I think it's interesting that she offered the creative therapies things as a like, if you're open to it, then we can do it. That makes it feel like she's more focused on like talk therapy stuff And the art therapy is just like a bonus if people are interested in.
Yeah.
So versus like writing your profile where it's art therapy centered.
Yeah.
So that's interesting to me.
Yeah. I feel like I want an art therapist to explain to me how art therapy is going to help me.
Right. And she might not be looking, again, she might not be intending to look for just clients who only want to do art therapy.
Sure.
She might be kind of like, well, talk therapy is the thing, but we can also do art therapy
Yeah.
as an offer.
And then she also lists play therapy and DBT and ERP in her types of therapy that she does. So, I don't know. Again, very vague.
Yeah.
She sounds nice. Like, I might
Yeah.
consider her as an option if I was
I would
depressed or
want
anxious,
to
but
call.
it was very sparse.
Yeah. Like I would want to do a consultation call with her before I like came in for actual intake or anything.
Yeah. All right. We're going to move to Castleberry, Florida.
Castleberry, that's cute.
Yeah, I don't know where that is. And we're going to look for a family therapist. Irene.
The face.
She looks like she took a selfie but didn't know that the camera was going to be open. And so she's just kind of like, oh, here I am.
Oh no.
I don't mind when people use selfies instead of like professional headshots.
Yeah.
But
Headshots are expensive. Yeah.
I don't know. She just looks caught off guard. Okay, she is a LMHC MCAP.
It's a lot of letters.
I think that's like addiction.
Oh, okay. Yeah, because that's like added on to your LMHC.
Yeah, certified addiction professional. She
Gotcha.
is telehealth only. Okay, I am here to listen and help you identify and achieve your goals, including relationships, stress, anxiety, depression, addiction, including opioid use disorder, and more. We will work together to identify triggers to life stressors and develop a plan using effective coping techniques to help you manage them. I care, have compassion, empathize, those are all synonyms, for those in need, and do not judge. We'll throw in another one
All
at
right.
the end. At times, you may just need to talk. My commitment is to meet you where you are in life, and I am currently offering online and phone sessions. I am a mental health counselor, LMHC, and Master Certified Addiction Professional, MCAP. I offer assistance with various personal mental health or addiction concerns. I understand how difficult life can be, especially during these times. I understand that you sometimes just need to talk and share what you are experiencing and to know that someone is listening and cares. I invite you to reach out and ask for help. There is nothing to be ashamed of, and don't be afraid. Together we will find a way to get through it. I think she sounds like a nice lady who doesn't know how to write a bio.
Yeah. Sounds like she might need some help rewriting that a little bit. It also like, so this was looking for a family therapist. She sounds like someone like if you're in addiction recovery, she would be a good candidate for. But I don't know about family. She didn't mention anything about that.
The only thing on here, like she says, like she does individuals, couples, and families, but like just as like one of the checkbox things.
Right.
So like I don't.
Yeah.
Like
reading
yeah,
that.
she does it, but like it's not a focus. So why is she the fourth one listed?
Yeah. Yeah. And like as someone looking for a therapist reading that, I would be like, oh, she just works for people who are in recovery.
Right.
And like maybe families who are being affected by that.
Maybe, but like I don't know.
But if that's not what I'm looking for, I wouldn't.
If that's not her main focus, if family therapy is not what she does, and I specifically checked, I want a family therapist.
Yeah. It's like, why'd
don't
she
know.
pop up?
Therapists pay $25 a month to have their profile on this website.
Yep.
Could we have somebody who works at Psychology Today work on these filters so that if I'm looking for a family therapist, Irene is not going to come up as the top result?
Right. Like instead of going by the check boxes for for like how the filter and the algorithm works, it
look at
needs
the
to go
bio.
through the bio too.
Yeah.
Which, like, I know computers are capable, or programs are capable of doing that.
They took Diane's second sentence in her bio and used that as the art therapy thing.
Yeah,
'Cause
yeah.
it said specifically, I do art therapy.
Interesting. Yeah.
I don't know. But
If I was looking for a family therapist, I would not pick her because she's just
no. So let's see if there's
recovery
a
focused.
different person on this list who does family therapy. Perhaps a marriage and family therapist intern?
An LMFT, right?
Well, yeah, she's not licensed yet. But
Oh, okay.
Nikki. Nikki is a marriage and family therapist intern. She says, "Hi, I love to look at clients through a holistic lens and treat trauma at the root. I believe in somatic healing as well as in a mind-body connection." That's what somatic healing is.
Yeah,
is it
she
not?
just didn't need to put somatic. She just needed to put, I believe in mind-body healing.
Okay.
Yeah.
You will be met with warmth, empathy, validation, and perspective. I love to explore clients presenting issues in relation to childhood, past experiences, and relationships to help connect patterns and narratives which can be carried throughout their lives. I love teaching clients how to effectively reframe thoughts, identify triggers and coping skills, engage more in their hobbies and interests, and improve communication and social skills. She loves her job.
Yes. I love.
My specialties include depression, anxiety, grief and loss, trauma, life transitions, LGBTQIA+, ADHD/autism, relationships, family issues, spirituality, and self-esteem.
Everything, yeah.
Girl, you're an intern.
Yeah.
Are they specialties or interests?
When I was an intern, I definitely was like, I want to do everything. And so I put everything on my stuff.
Yeah.
Except I was very picky and I was also like, but also just kids, please.
Yeah.
So I feel like that's where she's at. She's just like, I just want to do everything and get experience in everything.
Yeah.
Which is totally fine. But when you're making a profile on Psychology Today, like it's kind of a given with an intern that an intern wants experience in a lot of different things and they're interested in a lot of different things. So if you're like up for that, then that would be an okay way to go. But I also like how she's like, I love doing this and I love looking at clients like this. And I'm like, looking at them like a microscope, kind of, that's how that language made me feel a little bit.
Yeah.
So I was like, I don't want to be a guinea pig.
Mm-hmm.
So.
Okay. Yeah. She says, I teach clients to view issues from a systems lens and recognize what is and is not in their control. Radical acceptance, self-love, and growth are pillars of my philosophy. I am a reliable, warm presence. I will never judge you. I simply facilitate reflection and healing surrounding your deepest thoughts and feelings. I would love to get to know you and explore all that affects your daily life. Our relationship will be built on authenticity, respect, and trust. And please remember, you are worthy. I'm also confused because I'm looking at this page and it says she's an intern, but she doesn't specify like who she's under.
Yeah, you
Like,
have to list that. You have to list who your supervisor is.
And
like I am.
Somehow she's available Monday through Friday, 9 a.m. to 7 p.m.
Does she not have school?
Do you not have a will to live? How are you working that much?
Interesting.
And she's charging $130 a session and taking insurance. How? You're an intern.
Weird.
Like what?
I don't know what's going on there.
What insurance does she
Maybe
take?
she's not an intern anymore and she just hasn't taken that part off.
But why wouldn't she update that if she was updating everything else? Okay, she only takes Aetna, so maybe.
Okay, so she might still be an intern then.
Maybe, but $130 a session to see an intern?
Yeah.
How much is her supervisor charging?
I don't know. I don't charge $130 and I'm not an intern.
Again, she didn't really talk about family therapy.
Mm-mm.
And she has a ton of stuff under here, under her types of therapy.
Yeah.
She's got a blurb that says, I use symbolic experiential therapy, or symbolic experiential theory, CBT, solution focused, Bowen family systems theory, and emotionally focused therapy with individuals, families, and couples to identify negative interaction cycles and attachment styles. I am humanistic, person-centered, and culturally competent. I often use humor and compassion and enjoy the process of challenging narratives that clients no longer identify with.
So she kind of put all her clinical language right there into a blurb.
Yeah. What's symbolic experiential theory?
Symbolic experiential theory? I'm not sure. That sounds vaguely like Jungian-esque to me.
It's a type of family therapy. Carl Whitaker.
That sounds a familiar name.
Whitaker saw symptoms as mere signals of or even noisome distractions from the real existential problems faced by families: birth, growing up, separation, marriage, illness, and death.
Okay, so a little existentialism, family therapy, I guess. Okay.
So it's very emotional, relationship focused, being vulnerable.
Okay.
Okay.
That's a tricky
Bowen
family
systems.
That I've never heard of.
Interplay among family systems, emotional fusion, and differentiation. Emotional fusion refers to a state in which individuals become enmeshed with the emotions and needs of others, leading to unhealthy blurring of boundaries and loss of individuality. Differentiation involves maintaining a sense of self while remaining connected to others.
Okay.
So Bowen is focused on
enmeshed families,
triangulation.
Okay. Yeah, stuff that I know very little about.
Okay.
I wouldn't know.
So it's just
That's not
different
my
kinds
thing.
of family therapy lenses.
Yeah.
So, she does do a lot of family therapy
Stuff.
stuff.
Yeah,
It's
yeah.
just not very clear in her bio. And
Yeah.
until I went down here and Googled all of these things, I didn't hear a lot about family therapy, which is what I was searching for.
Which is probably a couple steps more than most people are wanting to take looking for a therapist on psychology today.
Because I can't look at symbolic experiential theory and emotionally focused therapy and know that those are family related things. The only one on here says Bowen family systems theory, but that's the only time she used family, really.
Yeah. She didn't use the key words.
Yeah.
Which means that the algorithm is just going by what you check off on your checkbox.
Right. I don't know, man.
I don't like that.
This is a lot. Anyway.
If I was looking for a family therapist and I read her profile, it would be a maybe?
Yeah.
Because she's kind of like a open to all situation, which makes sense as an intern. But I would need like a little more context maybe, but not all the clinical jargon context.
Right.
I would just want to be like, hey,
what the theory is. I want to know how you're going to help me.
Yeah, like what do you do though?
Yeah. Yeah. So I don't know, going through with the different filters and the different zip codes and stuff kind of reaffirmed that like there's not a lot of therapists.
Yeah. Once you start adding filters, it gets less and less for sure.
And it's difficult to look at a bio and really understand like who's going to be a good fit, because I feel like we liked the profiles that were very much just like friendly conversational instead of here's every theory that I subscribe to.
Right.
Because I don't know if that means that I'm going to like you as a person if I come to see you.
Yeah.
Whereas some of the other ones were like, oh my gosh, you sound like a nice person. Like, I don't care as much about what theory or what techniques you're going to use. I want to know that you care about me as a client.
Yeah. Like you're using language that speaks to me, and that already makes me feel like we've got rapport built.
Yeah.
Of some kind, even a tiny bit.
Yeah.
Yeah. I think psychology today is a first place to go, but it's very hard if you don't know what you're looking for. And then it's also really hard if you do.
Mm-hmm.
So it's like, how specific do you want to get?
Yeah.
With what you're looking for? It's tricky.
Mm-hmm.
Yeah.
Yeah. I would wonder if anybody has come across a therapist's bio, either on Psychology Today or like a therapist website or something, and it was confusing to you. Send it to us, and maybe we'll read it and
Yeah.
go
Try
through
to
it
decode it
and
a
explain
little.
it. Yeah.
I like the idea of decoding some of this
Yeah.
stuff, because some of that stuff I hadn't heard of,
Mhm.
like the family therapy stuff. I'm not familiar with that. That's not really my expertise
Yeah.
or my training. So if I was reading that, I would be like, I don't know what that is.
Mm-hmm.
If I don't know what it is, then it's probably not for me.
Mm-hmm.
If I was looking for a therapist, but
Right. I shouldn't have to open 12 tabs
right
when looking for a therapist.
Right.
Yeah. Or if you liked just going through the random zip codes and picking random people to look at, I thought it was fun.
That was fun.
But let me know if you want us to do it again, because it was fun for me.
Yeah, it's interesting to see like therapists around the country and like what they're into and what they charge. Do
Mhm.
they take insurance? Are they telehealth only? There's a lot of telehealth
A
only
lot of
people.
telehealth only. Yeah.
That's not my vibe.
Me neither. I don't want a telehealth
I
therapist.
only ever do it for intakes or like adults.
Yeah. I'll only do it
That's
for adults on my end, but I don't want my therapist to be telehealth.
No.
I feel like I connect better in person.
Yeah, I connect better in person, and I like the ritual of going to a separate place to
Mhm.
do my therapy work. I don't like doing it at home.
Yeah.
I already do too much at home.
Mm-hmm.
So,
Fair.
yeah.
Yeah. Okay. Should we do Reddit stuff?
Yeah, let's see what I got. Okay. Part 2 of today. So I just got on Reddit, one of our favorite places of the internet, and I just put in find a therapist or finding a therapist,
Mhm.
and found some stuff that was interesting. So how to increase my odds of finding a therapist that I'll vibe with. This is within Ask a Therapist. Silly question because you don't know until you know. Besides just reading up on their bios, are there any other ways I can find more info to see if we'll mesh well? I hate the trial and error, having to discuss really uncomfortable things to someone that I don't feel comfortable with yet, even if it is just part of the intake.
Fair.
Yeah.
Fair question. Because we didn't get that vibe from any of these profiles we read.
Right. Yeah. There was like a couple that I was like, maybe we'll vibe. Like that first one, I was like, okay, you're speaking a language that I like to hear.
Mm-hmm.
But I would want a phone call with all of those people
Yeah.
for sure.
But even the phone call, you don't always get a good enough vibe. Sometimes it takes a few sessions.
Right. And it's hard. Yeah. And like they're saying in this Reddit thread, like the trial and error of having to, like, if you start with a therapist and then you realize it's not going to work and then you have to start over with someone else and go through all the same stuff again, like that's kind of, it feels tedious and then you don't want to do it anymore,
Right.
even if you need to. So some people had some suggestions. The first one was that many people offer a phone consultation, but like we said, sometimes you can't suss out the vibe with just a phone consultation. Someone said that you could just set up consultations with like a bunch of therapists back to back over a couple of weeks, and then do like follow up with the ones you felt okay with and see if they're willing to talk more or do something like communicate more, I guess.
Yeah.
But
I mean, you could try.
I was
feel
gonna say, like, as a therapist, I only offer like one free consultation phone call. And then after that point, I'm kind of like, what are we doing here?
Mm-hmm.
And that's just because, like, we can't really get into things until you're my client.
Right.
So, like, we're at a wall after that consultation of, like,
Yeah, because at some point, if it starts feeling like a therapy session over the phone, like it's not ethical for me to talk about certain things unless you've already signed a consent for treatment. Like,
right.
if you're not my client, there's only so much I can do.
Yeah. Yeah. And those consultation calls are mostly to talk about like, here's what sessions are going to look like. What are your main concerns right now? Okay, got it. Here's my availability. Here's how I do therapy as a therapist. Do you want to go on to the next step? That's what consultation calls are. And that's it.
Yeah.
There's not really anything else we can do outside of that ethically. You have to be a client and you have to have a scheduled session to talk in depth more and therapeutically about the stuff you're working on. So like, it's hard to suss out the vibe in a consultation call, but you also don't know the vibe until you've been in therapy a couple sessions. And the vibe can change too. Like, you might start out awkward and then just click a couple months later, maybe, and then things are fine. So, I mean, maybe give it time and just keep an eye out for any red flags that you're absolutely not okay with. But that'd be my advice. Like, you have to kind of just give it time.
Hard. Yeah, it's hard. Yeah. It feels like dating sometimes. Like,
that's one of the posts that I have.
Really?
Yeah. It's about how finding a therapists feel like they're on dating apps for clients is what it feels like. And I 100% agree. That's what it feels like.
Yeah, I want to hear about that.
Yeah. And then everyone else basically just like was the same thing. Just try and do consultation calls. That's really all you can do until you're actually in therapy.
Yeah.
Unfortunately.
It does suck. Like, especially if it's like I'm going for trauma and I need to tell you about my trauma before you can do anything, but also I don't know you. Like,
yeah. I saw, I think it was on TikTok, someone that like made a slideshow about themselves for their new therapist. And they were like, honestly, this was the best thing I could have done because it's something that I have, you know, tangible to talk about. And it helped them like make it easier to talk about their stuff with a new therapist. And I thought that was kind of funny because I was like, yeah, when you see a new therapist, you have to go through like the whole thing again. But having like a slideshow of the timeline of your life and your trauma, it's like, here you go.
Yeah.
Makes it a little easier. So maybe doing something like that. This one is from the Reddit Ask Men asking men advice. How do you find a good therapist? I've been told by multiple people that I could use it, as in therapy, and they're probably right. I believe in it and in fact had a good experience with it in my 20s, but for reasons I'd rather not get into, I don't feel like I can go back to the same therapist. Cool.
Fair enough.
Yeah. I've gone through 4 different therapists over the past 10 years with no success. No real connection, never felt totally comfortable with them, and it became a chore to go, so I stopped. Perhaps I'm doing something wrong, or I'm just unlucky. I just have run-of-the-mill anxiety, nothing serious or traumatic, but enough that I feel like it's holding me back in life. If you managed to find a good therapist, when did you realize it was a good match, and how long did it take to find them? Someone compared finding a good therapist is like finding a good car. You need to find the right fit for yourself. Unfortunately, no one on Reddit can tell you what works for you. You need to find someone you click with, and only you can determine if you found the right one. It's like,
I've never been compared to a car before.
Me neither. That's a new one. I'm not a car. You could try narrowing your search by determining what kind of therapist you want or what you want to focus on, like gender, religion, ethnicity, specialty, experience. Unfortunately, you just need to keep trying until you get the right one. Sad face. But don't feel too bad for the therapist, or don't feel too bad for the therapist. They understand when a client isn't comfortable with them and may even suggest other therapists for you to ask.
Yeah.
Which is very true. I've had a couple times where people come in for the intake and maybe have a couple sessions and have brought up like, I don't know if this is going to work. And I'm like, cool, well, what are you looking for? And I can help you find someone.
Right.
Because
I tell people that in intakes all the time. I'm like, if we don't click, that's okay.
Oh,
you will not hurt my feelings.
That's part of my spiel. Yeah. Of like, it's not going to hurt my feelings if you think this isn't going to work. I'll help you find someone that might be a better fit.
And that would be better. Like, I find it rewarding to help people find therapists outside of here's a list from Psychology Today. Like, if I know people and like, oh my gosh, I don't understand your Star Trek references, but the guy next door will.
Right,
like,
yeah. Or like you're a middle-aged white man and you're having problems with your childhood trauma and you don't feel like talking to me about it's going to vibe, I know a guy.
Yeah.
I know a guy who that's all he does with his clients.
Yeah.
So I can help you with that. Like we will help you if you come in and feel like it's not going to fit. We're going to help you find someone who does, and we're going to be really good people to help you with that because we personally know a lot of people,
Right.
and a lot of options. And
Yeah.
if we don't, they know people. We can crowdsource for you the information and find you someone that will be a better fit.
Yeah, because I've put out there multiple times like, hey, this person is looking for a therapist who is going to give them no BS, like in
Yeah.
quotations, like no
That's
BS.
what they requested.
Young 30s female therapist who will call them out on their bullshit. Like,
Yeah.
that's not going to be in your Psychology Today profile.
Yeah.
But like, somebody's going to be like, oh yeah, I tell my clients all the time, like, that's bullshit. Like,
Yeah.
I might be a good fit. Like,
Right. Right.
or like, even if you don't know a therapist or you don't, you haven't gone to a consultation yet, if you have a friend who's in therapy who could maybe ask their therapist for
Mhm.
recommendations, like, outsource,
Yeah.
because it's difficult to just do a Google search sometimes.
Yeah. And intimidating because a lot will probably pop up.
Right.
And it's hard to know what to look for if you're going to therapy for the first time.
Yeah. And there's other therapists outside of Psychology Today. Like, I'm
Mhm.
not on Psychology Today anymore because I don't want to pay $25 a month. And
Right.
when people call my group practice, they're put with who the administrative person thinks is going to be a good fit for them.
Yeah.
My bio's on the website, but unless you're on my practice's website, you're not going to see my bio. But a friend that I have that's a therapist might refer them to me. So,
Yeah.
there's lots of different ways to look for a therapist.
And a lot of group places, yeah, you call like the administrative person and they have like all of the documents and all of the bios like pulled up or whatever and can help match you up.
Right. They have the schedules. They have, if they're taking new clients, like that's all on their end.
Yeah. And you can, most places too, you can just send them an email even. You don't even have to call and be like, hey, this is what's going on. This is what I want to work on. Do you have a therapist who you think would be a good fit? And
Right.
most places have someone who like goes through those emails and will try and match you up the best that they can.
Right.
That's how I get most of my clients.
Mhm.
I rarely get them straight from Psychology Today anymore. I did
Yeah.
when I first was on there, but not anymore.
Yeah. All of my clients are through Pamela now.
Yeah. Thanks, Pam. Yeah, I probably don't need my Psychology Today profile anymore, but it helps at first.
Mm-hmm.
Lots of people on here saying like, don't feel disheartened, don't be down. Like, not every therapist is going to be a good fit, but you kind of have to keep trying.
Mm-hmm.
And then someone mentioned like considering, because this is the Ask Men Reddit, they said try specifically searching for a male therapist, like gender matching yourself to your therapist. I could see that being helpful for, it sounds like this original poster guy might. Yeah, he said, always had women therapists before. I'm going to try a male therapist this time.
Yeah.
So yeah, that might be what's different for you,
Mm-hmm.
and different enough and a different perspective that it's helpful.
Yeah.
So just changing up, your search requirements can help. Someone said that they specifically wanted a female therapist because they tend to be better listeners, they said. That's funny. But they knew that was specifically who they were looking for, and so that helped them figure it out. And they specifically wanted someone LGBTQ plus affirming.
Sure. Yeah.
So if you have like an idea in your head of like, this is what the perfect therapist, not perfect, this is what I want my therapist to be like, then you can search by that. You can search by gender. You can search by if they're a person of color or not. Like those filters are on there. So you can get specific like that too. And that just helps with different lifestyles, different backgrounds. Like a white therapist seeing a black client is going to be very different than a black therapist seeing a black client. That's just how it is.
Right.
It's just like that. So matching yourself demographically a little bit can help. And then someone said that they're from Germany and don't speak English, and that was a problem. And I was like, well, yeah, sorry, bud. Like,
Yeah.
you
that's
kind of
hard.
have to. That's a specific enough language here that you gotta search that. In Ask Reddit, someone asked, what is the best way to find a therapist you feel comfortable talking to? What are some tips to get out of the whole process? This has 119 comments. The first one is from a therapist. So they say, therapist here, before you go to an intake, write down what you want to be different as a result of therapy. So different from your previous therapist. That is one of the like first questions I ask.
Me too.
Is like, so what's your experience with therapy? What did you not like about your past experiences?
What worked, what didn't work?
Because that helps me narrow down what we're not going to do.
Mm-hmm.
If CBT didn't work for you, we're not doing it. If EMDR didn't work for you, I'm not certified in it, but like, I'm not going to refer you out for EMDR.
Mm-hmm.
And then that helps me figure out what we're going to do.
Right.
And
I like to ask people specifically, like, are you somebody who feels like therapy is mostly helpful because you get to vent and let it all out to somebody who doesn't know everybody that you know? Do you want resources? Do you want homework? Like,
right.
How do you work best? And if your description of like what works best for you is not my style, then I will help you find someone.
Yeah. And if in an intake or first session, when your therapist is asking you questions about like how you like to learn or how you like to process things, be honest with them.
Yeah.
Be honest with your therapist all the time. But like, especially in those first sessions, like if you really hate worksheets, tell your therapist, I hate worksheets. I fucking hate worksheets.
Mm-hmm.
They're not going to give you worksheets then. But if you don't tell me that you don't like or you learn a different way and then I don't know that, I'm going to use the methods that I typically use and then they're not going to work. So you're not going to see progress. Right? So you got to let me know how you learn best, how you process best, what works for you, what doesn't, so that I can tailor the sessions to you so that they'll actually work.
Right. And maybe you've never had therapy before, so you don't know what kind of therapy works best.
Mm-hmm.
But you know, like, if you enjoy receiving direct communication or if you need your hand held a little bit.
Right,
so
right.
you can explain that. Like, like we are very... It's important to us that we ask those questions for our own peace of mind. But, yeah, like that person said, go in with that list of, like, here's what I need. Do you do that?
Yeah.
Just as, like, it's easier for me if I'm going to, like, my primary care doctor to have a list of, like, here's my concerns so that I don't get lost in the weeds of, like, well, lose weight or whatever. Like, I need to be like, here are the symptoms. Please help me with each of these things. Like,
right. Getting specific about it.
Mm-hmm.
Yeah. And I like to ask, because I work with a lot of like preteens and teens. I'm like, in what ways do you learn at school best? Because there's a lot of crossover between how you learn and how you process your emotions. It's a communication thing. So if you're a visual learner, we're going to do visual stuff in sessions. If you prefer to talk through the things that you learn, then we'll talk through the stuff in sessions.
Yeah.
Like, I want to make sure that we're communicating in a way that's comfortable and makes the most sense to you.
Yeah.
So that's why I like to ask the question of like, what kind of learner are you? How do you learn best? And some people like to have resources like books and podcasts and stuff. And I love giving those because I love resources. But if you don't like resources, I'm not going to give you homework.
Right.
I'm not going to make you do
homework if you know you're not going to do it, because then we're both frustrated. Like, okay, I found this homework for you and you didn't do it.
Right.
So now you're frustrated with me because I gave you extra work, and I'm frustrated with you because I went through extra work to give you extra work. And
I like reread this book about dealing with teenagers because I thought you were going to read it and then you didn't, even though you asked for resources or whatever. And it's like, well, okay.
Yeah.
Yeah, interesting stuff. Yeah, and this therapist said also, like, give it time. Don't expect 50 minutes to solve all your problems.
Right.
The best progress you will make is what you do outside of session.
True. Yeah, and I agree. Like, it's hard. You can get a vibe of, like, I enjoy this person's personality, but don't expect to, like, have a goal for therapy and be good in a month.
Right. It's not really how. There's not really, as much as insurance likes to think, there's not a timeline for your treatment in therapy. The timeline is when you feel better enough that you don't need it anymore.
Right.
That could be anything.
Mm-hmm.
But it's usually a while. It's usually longer than you would like for most people. Someone made like a sarcastic comment like, "Hey doc, I want to learn more to be more patient with people. I expect you to fix me during one session. Technically my appointment started 4 minutes ago, so you really need to hurry." It's like, sometimes that's what it feels like. We're being told as therapists. Yeah, a lot of people just saying the same thing. Someone said that they found their therapist on Psychology Today. I got lucky. Someone is like, it's basically like a Goldilocks situation. You won't really know what you're looking for until you find the stuff you don't like about therapy. That is true. Someone said, how long were you in therapy? Was it a year or months, weeks? How much time did you give it? Yeah, a lot of people are saying like more time. And then someone was like, take medication about it. And I was like, no. But time, unfortunately, or fortunately, I guess is really what it is. Giving it more time. And then someone asked on Ask a Therapist, what are some early signs that a therapist will be a good fit or a bad fit? And someone made a list. Bad fit. If you're talking to the therapist and they get annoyed. Oh, wait. If you're talking to them and get annoyed or frustrated by them, so your therapist annoys or frustrates you, it means you're not vibing. You feel like they don't understand you. If they try to change your mind on any decisions you're making.
I mean, if they're telling you directly, like, no, don't do that.
Right.
That's, well, you know, unless it's like, I feel like going to kill somebody.
Yeah, maybe don't do that.
But like, yeah, but if they're challenging you to look at something in a different way, but ultimately still leaving it up to you, I feel like that's therapy.
Yeah.
If they're saying like, no, deep breathing is a bad thing.
Right. And I think that's the struggle, at least what I have, is like people will feel I'll challenge them on something and they feel like I'm telling them what to do or I'm like telling them to not do a thing. And I'm like, I'm just asking where that thought pattern came from and where, like, how did that come about? Where did it come from? But like, I don't know. I feel like a lot of people, they feel challenged and then they're like, nope, shutting down. If your therapist talks about themselves more than about you, that's a huge red flag. When you leave, you feel worse about yourself. You don't trust them enough to share any more with them, which sounds like that's what their original poster on the last one was the issue, was they just didn't feel like they could trust the therapist to tell them more.
Yeah.
Because there's always more to talk about, but they never got past that level of trust that they needed to feel like they could tell more, which is probably they needed more time. They needed to give it more time or tell their therapist, hey, I don't feel like we're at a point where I can talk about more with you. There is more I want to talk about, but I think we need to like figure out a higher level of trust somehow first.
Yeah.
Which you can say to your therapist. You can tell them like, hey, I'm not ready for that right now, or I want to, but not yet.
You can, or you can email it.
Yeah, you can also just email it if you don't want to do it face to face. That's totally fine too. Some good fit or green flag signs. You feel like they understand you and get it when you say stuff. You leave the session with a lot to think about. Not necessarily feeling bad about yourself, but you have a lot to think about. When you leave, you feel like the things that are bothering you can now change. You're not stuck. When you leave, you feel a bit better about yourself, even if you might also be sad or emotional at the same time. You find yourself remembering moments of therapy in a positive way, or at least a thought-provoking way. you find yourself wanting to share more things with your therapist over time, or wondering how they'd react to something that you would share with them.
Mm-hmm.
So like thinking about like, oh, I wonder if this is something I could talk to my therapist about at the next session. I'm going to bring it up next time.
Yeah.
Just like thinking that way outside of session is a sign of progress.
Yeah.
Because it's a sign of self-awareness.
Yeah. I would also add, like, when you leave a session, having some clarity on, like, what you're going to do next.
Yes. Yeah.
You're
You
not going to
shouldn't
get
be
that
more
from
confused.
every session,
Mm-hmm.
but if on the whole you're feeling like, okay, I feel more comfortable with the decisions that I'm making, that's a good sign.
Yeah. Yeah. Because, yeah. And like they said, too, you're going to leave some sessions maybe being sad or emotional about something, but there should also at the same time be a little bit of that clarity or a little bit of understanding at the same time.
Mm-hmm.
Those two things can happen at the same time.
Yeah. Let's do the one that you talked about with the dating
Oh,
reference, and then let's be done because it's being like choppy, and I'm worried
About it? Okay.
Gonna mess up somehow.
Okay, we'll do this fast. Well, it's long, so I'll read it as fast as I can. Okay. So this is under the therapist Reddit. Anyone else ever feel like our jobs are starting to feel more and more like we're on some kind of therapist dating app? Over the last year or so, maybe since these venture companies took over most insurance clients, I feel like I'm in a perpetual dating app for therapists. Hear me out. In dating nowadays, everyone's always looking for the next best thing. We find someone we think we click with, and then we think we may find something better, so we check out and start searching for the next best thing. It feels like clients are doing just this. I used to just click with clients immediately, and they have stayed with me for a long time. We would do the work, and then they would graduate services and move on with our lives, and if they needed help years down the line, they might call in for a touch-up. But now I feel clients are jumping from one therapist to the next. At one point, I stopped doing intakes with these companies and just called clients for a consultation to ensure we were a good match before meeting for the intake, even though the companies want you to just meet them right off the bat. I found that when I met with them, we would have a short meeting, we would see we were not a good match, or they were just therapist shopping, in their words. And then I couldn't bill them for the intake because they were not interested in services. They had other meetings with another therapist and would decide which one was best. I've started feeling like a fraud and a bad therapist, like I was unwanted. And it started to mess with my head like I was not a good enough of a therapist, even though I've been told by so many clients how amazing I am and how glad they were they found me after some horror stories. What have your experiences been like with this, and how did you manage to not let it affect you?
I'm not familiar with like insurance companies referring clients to therapists.
Yeah, I'm not sure what that process is about. It's something where I think it's just it's a money thing, of course, but like
Right.
the insurance company wants you to just have that intake right off the bat because you charge for an intake and they make money off of it.
Yeah.
So, but then what this person is saying is that we do the intake, we're not a good fit, or they're therapist shopping and they might not schedule with me, so they go see someone else. And they're just getting frustrated with that process, I guess.
It sounds frustrating.
Right.
It's not something I've experienced. And I've also not had the experience of not being able to bill for the intake session.
Yeah, that's weird. They say they're in California, so it must be a California thing.
Maybe.
I don't think we have that
Some
problem
sort of
here.
Law with the insurance or something. But
Yeah.
yeah, if I give you a full session, even if it's just an intake, you're getting billed for it.
Right. That was an hour and a half of my
someone's
day.
gonna pay me
Right.
for the
right.
hour of my time. Yeah.
Yeah. But it was just interesting that they were talking about how they felt like before they would click with a client and then over time maybe like stuff would come up, but they would work on it together. And now it's like as soon as they have a client and the client feels like it's not going to be a good fit, they're out of there without trying to make it work, I think is what they're frustrated about too.
I mean, I like their strategy of if they get a referral before the intake, calling them to give them a consultation. I feel
Right.
like that's beneficial for both the therapist and the client.
Yeah, because it could save time for the client and the therapist
Yeah.
if they're not going to be a good fit. I've done that a couple times where I've had an intake come my way and I look at their paperwork and I'm like, this is not my area. This is not anywhere near my area at all, and not appropriate for me to see this client for XYZ reason. And so then I, call them and help them find somebody.
Mm-hmm.
So, but I get their frustration with, I guess, how people are, or how they feel that clients are just dropping out of therapy and trying new therapists almost too fast.
Right.
They're not giving it time, I think is what they're worried about.
Yeah.
Which I can see. I've not had that problem. Well, I guess I have kind of had that problem. I've had parents bring a kid in, and then for whatever reason, they feel like the therapy isn't working after a certain amount of time, and then they kind of abruptly stop.
Yeah.
I've had that happen. At the same time, that's kind of the deal with our job.
Mm-hmm.
Also, like, the client's in control, or their parents are in control of when they see us. So if they don't want to come anymore, then they don't have to.
Yeah. I don't know. Yeah. That's a unique situation that I haven't heard of.
Yeah, I don't understand the insurance
it does
stuff.
Sound frustrating.
Right. And I don't know. I think you're right. Like, doing a little phone call beforehand is going to help, but I think it's something out of their control, and they either need to, like, be okay with the process or not take insurance, maybe. I don't know.
I mean, I think it's another indication that there's not enough therapists.
Oh, yeah.
Because if they're getting referrals for people that are clearly not a good fit, maybe they're one of a few therapists that takes that insurance,
Mhm.
or they're one of the few therapists in that area, and it's just not working because more people need therapy than there are therapists.
Right. And I don't think people realize that that's going on either. I don't think people that aren't therapists and don't know therapists personally realize that there's literally not enough of us.
I mean, it's kind of clear when you start looking for a therapist and you're like,
Right.
who are these people? Like,
Right.
These are my options. Like,
This is it.
Yeah.
I think sometimes people just kind of get lost in the sauce of, like, no one's available to see me, and getting frustrated, but there's literally not enough therapists to cover all of the clients that need therapy, all the people that
and
need
it's
therapy.
hard to find somebody who's available when you're available, or
Yeah.
these art therapists that we were looking at that are online only. Like, if I'm looking for an art therapist, I don't want to buy all my own supplies for art therapy. Like, I don't know.
It's so hard to, not that it's impossible, but it is so hard to do art therapy online.
Mm-hmm.
Like, and that's why I don't offer it.
Yeah.
I only offer telehealth to adults for talking only.
Mm-hmm. Yeah, I think it's pretty clear when you're trying to look for a therapist that there's not a lot of options.
Yeah.
And the more niche your problem is, the harder it is to find somebody who specializes in that,
Mhm.
or actually specializes in it, instead of just
Right.
having a slight interest in putting it on their profile.
Yeah. I think we should probably read through some more Psychology Today profiles at some point and do more, like, decoding, because I think that's a thing too, where people are going there into Psychology Today and they don't know what any of this stuff means.
Mm-hmm.
They don't know, like, the difference between being an art therapist or someone who uses art in therapy, or, like, they don't know that there's a certain type of therapy that's just for kids and a certain type of therapy that's more for teen. Like, people don't know that stuff.
Right.
So we need to make it either explicitly clear on our profile, or we need to be a little more vague and try to get you that way.
Yeah.
To try to figure out the vibe first and then tell you what we can offer,
Yeah.
which is typically what most people should be doing on Psychology Today.
Yeah, but it's hard because they give you just a checklist,
Yeah.
and then they
It's
say,
hard to
in
not
this
be like, yep.
paragraph, talk about this. In this paragraph, talk about this. And then it's hard to not to be like, I need clients. I had a
Mhm.
client once that had OCD. I'll say that I work with OCD clients because technically
Right.
I do. And
Right.
it's like, okay, but if somebody has debilitating OCD, they should not come to me.
Right. Yeah. So it's like, what are the top 4 things that, like, 50% or more of my clients cover?
Yeah.
Like, what are they? For me, it's like autism, ADHD, and anxiety,
Mhm.
and teenagers.
Right.
That's my thing.
Ugh. Yeah, I don't know. It's tricky. But yeah, I think going through those might be helpful.
Mm-hmm. Just to decode them. Yeah.
Yeah, and I think it's a struggle on both ends. It's a struggle for therapists to find clients that are a good fit, and it's a struggle for clients to find therapists that are a good fit.
Yeah.
And then you run into like, I don't want to make an appointment anymore, and the therapist is like, please make an appointment. I need money. Like,
Yeah.
Yeah.
I need to put you on my caseload to fill up my hours.
Yeah.
Yeah. It's a lot.
Mm-hmm. Yeah. Tell us about your experience of finding your therapist. Do you love your therapist? And if so, why? And how did you know? If you are having trouble finding a therapist, tell us about that process. We want to know. We want to hear from you.
Yeah.
And then while you're at it, like and subscribe.
And share.
And share
Tell
us
people about us.
with your friends so they can tell us about their experiences with therapy. And
Yes.
then we can talk about it.
Yeah, I think, like the more people talk about their experiences with trying to find a therapist and how hard it is, the more it kind of like educates other people on the process and makes it easier for them.
Yeah.
So if we like keep talking about it, it's going to help other people out
Mm-hmm.
at the very least.
I agree.
That's kind of the point of this podcast.
Mm-hmm. Yep. So let us know.
Tell
and
us.
then tune in again when we talk about other stuff
Yeah, TBD stuff.
related to therapy. We've got guests coming.
Woo!
We've got exciting things in the works. So make sure you're following so you don't miss out.
Yep.
Be part of the club.
Part of our club, the Dumpster Fire Club.
Yeah. All right. Well, anything else?
That's it for me. I'm tired now.
Yeah.